morning, my name is Dermot O'Flynn. I'm the Director of Professional Development and Training at the Royal College of Surgeons Institute of Leadership based in Dublin. However, we also have faculty in Bahrain, Dubai and Jordan. And the reason I'm at the conference is actually to present two of my posters, one on a lean learning solution for Train the Trainer for doctors and also an online solution for patient safety. Let me talk about the Train the Trainer first. In Ireland, it's a core competency that all doctors must have the ability to teach their juniors. And because they're so busy in the workplace, they don't get time to take out to actually study this in detail. So we've developed an online Train the Trainer program with the Royal College of Physicians in Ireland and the Royal College of Surgeons in Ireland to actually allow people to do 5 modules online. And these include how to present a clinical skill, so how to present on clinical facts and figures, how to teach a clinical skill to their juniors, how to get feedback to a junior who's struggling, having some difficulty, and also the whole area of assessment and teach at the bedside. And once people have done the course online, they can then do a series of multi-choice questions, and on completing those and getting 80%, they can come forward for assessment to assess their ability to actually deliver a presentation, to actually teach a skill and to actually give feedback correctly. And on completing the assessment, they can then actually be certified from the Royal College of Surgeons and the Royal College of Physicians as a competent trainer. The other post I'm here to present is in relation to the whole area of patient safety. Anywhere in the world, people are very conscious that the patient is the most important part of our service delivery. However, doctors, surgeons and the allied health professionals are all making mistakes and causing errors to outcomes for their patients. So we were asked again by the Irish Health Authority, the HSE, to develop an online patient safety program for doctors in Ireland. And this was jointly developed by the Royal College of Surgeons and the Royal College of Physicians. And what the course looks at is looking at what is patient safety, why is it such a big issue, look at the whole area of adverse events and why did they actually occur, looking at how communication can help reduce these adverse events occurring, and then looking at the second victim, who is, yes, we have the patient as the first victim, but the second victim actually is the doctor or clinician who's actually made the mistake, and how can we manage and cope with them to deal with these problems. And each module has a case study linked in, so it's very, very interactive and learning takes place. In Ireland, we've decided that all junior doctors on rotation, either in surgery or in a physician's rotation, will actually do this course mandatory from 2011 onwards. And again, they'll have a series of MCQ questions to be tested on at the end and be certified for that. So the opportunity to come to this conference is to let our colleagues know in the Middle East that we are very conscious about professional development of doctors, but also the allied health professions. And so far, I've had a lot of inquiries from hospitals and health authorities on how we can actually implement these courses in the region, but also implement them for the other clinical areas such as nursing, physiotherapy, nutritionists, etc. So delighted to be here and look forward to coming back next year.